Hello, everyone. In previous lecture, we have studied about applied psychology and its different branches. We have discussed the merits and demerits of each of them. In the last section of the lecture, we have started talking about methods of psychology, and we discussed about introspection, method, and a little bit about experimental method. So let's continue the chapter. Now let's talk about the merits of experimental method. Number 1, causation. One of the primary strengths is the ability to establish cause and effect relationships. By manipulating an independent variable and observing its impact on a dependent variable, while controlling for extraneous factors, researchers can draw conclusions about causation. Number 2, controlled environment. Experimental designs allow for a high degree of control over the research environment, minimizing confounding variables and increasing the internal validity of the study. Number 3, replicability. Well-designed experiments can be replicated by other researchers, enhancing the reliability and generalizability of findings across different samples and contexts. And number 4, precision, et. Experimental methods often involve precise measurements and quantitative data, providing a level of precision in data analysis and interpretation. Number 5, objectivity. The experimental method emphasizes objectivity in data collection and analysis, reducing the impact of subjective biases that might influence observational methods. Number 6, generalizability. While experimental studies may focus on specific variables, carefully designed experiments can contribute to broader theoretical frameworks and general principles in psychology. And now let's talk about the demerits of experimental method. Number 1, artificiality. Experimental settings may lack ecological validity, and participants' behavior might be influenced by the artificiality of the laboratory environment, leading to concerns about the generalizability of findings to real-world situations. Number 2, the ethical constraints. Some experimental manipulations, particularly in social psychology, might involve ethically sensitive procedures or raise concerns about the well-being of participants. Number 3, limited applicability. The controlled nature of experiments may limit the applicability of findings to complex, real-world situations where multiple variables interact in dynamic ways. Number 4, demand characteristics. Participants may modify their behavior in response to perceived expectations or cues from the researcher, introducing demand characteristics that can confound results. Number 5, experimenter bias. Researchers' expectations and biases can unintentionally influence the conduct of the experiment, potentially impacting the results. Number 6, time and resource intensive. Well-designed experiments often require significant time, resources, and planning. This can be a limitation, especially for large-scale or long-term studies. Number 7, limited external validity. While experiments provide internal validity, their findings may not always generalize to diverse populations or real-world settings, limiting external validity. Number 3, clinical or case history method. The clinical or case history method in psychology involves an in-depth examination and analysis of an individual's psychological and medical history. This method is commonly used in clinical and counseling settings to gain a comprehensive understanding of a patient's background, symptoms, and overall mental health. Here is some of the key components of the clinical or case history method. Number 1, background information. That is, gathering detailed information about the patient's personal history, including family background, upbringing, education, and significant life events. Number 2, medical history. examining the patient's medical history, including any past or current physical health issues, medications, and treatments. Number 3, psychosocial history. Exploring the patient's social relationships, lifestyle, employment, and overall social context. This may include assessing the quality of relationships, support systems, and daily life stressors. Number 4, personality assessment. Employing standardized psychological assessments or interviews to evaluate personality traits, coping styles, and overall psychological functioning. Number 5, diagnostic evaluation and treatment history. Reviewing any previous psychological treatments or interventions the patient has undergone, including therapy, medication, or hospitalizations. Now let's talk about the merits of clinical or case history method. Number 1, comprehensive overview. It offers a detailed and comprehensive understanding of the individual's life, experiences, and psychological challenges. Number 2, tailored treatment. It facilitates personalized and tailored psychological interventions based on the unique circumstances and needs of the patient. Number 3, longitudinal perspective. Allows clinicians to consider the patient's developmental history and how experiences over time may contribute to current mental health issues. Number 4, therapeutic relationship. Contributes to the development of a strong therapeutic alliance between the nurse and the patient by actively listening to the patient's narrative. Now, the demerits of clinical or case history method. Number 1, subjective reporting. It relies on the patient's subjective reports, which may be influenced by memory biases, perception, and individual interpretation. Number 2, limited generalizability. Findings from a single case may not apply to others, limiting the generalizability of the information. Number 3, potential for selective reporting. Patients may choose to disclose specific information, potentially impacting the accuracy and completeness of the case history. Number 4, time constraints. Conducting a thorough case history can be time-consuming, and there may be practical constraints in clinical settings. Number 5, limited applicability. Findings may be specific to the individual's case and may have limited applicability to broader psychological principles or diverse populations. Now let's talk about the survey method of psychology. The survey method in psychology involves the collection of data from a sample of individuals through the administration of questionnaires or interviews. This method is widely used to gather information about attitudes, opinions, behaviors, and other characteristics from a large and diverse population. Surveys can be conducted in various settings, including academic research, market research, and public opinion polling. The key components of the survey method include sampling, where researchers select a sample of individuals from the larger population. The sample should be representative to ensure that findings can be generalized to the broader population. Number 2, questionnaire design. Researchers develop a set of questions to elicit information from participants. These questions can be open-ended, closed-ended, or a combination of both. The wording and structure of questions are critical to obtaining accurate and reliable responses. Number 3, administration. Surveys can be administered in different ways, including self-administered paper surveys, online surveys, telephone interviews, or face-to-face interviews. The chosen method depends on the research goals and the characteristics of the target population. Number 4, data collection. Participants respond to survey questions, providing quantitative or qualitative data depending on the nature of the questions and response format. Number 5, data analysis. Researchers analyze the collected data using statistical techniques to identify patterns, trends, and relationships between variables. Now let's talk about the merits of survey method. Number 1, efficiency. Surveys allow researchers to collect data from a large number of participants efficiently, providing a broad perspective on the studied phenomenon. Number 2, standardization. The use of standardized questionnaires ensures consistency in data collection, enhancing the reliability of the results. Number 3, anonymity and confidentiality. Participants can respond without revealing their identity, promoting more honest and open responses on sensitive topics. Number 4, versatility. Surveys can be adapted for various purposes, including academic research, market research, public opinion polls, and program evaluations. Now the demerits of survey method. Number 1, response bias. Participants may provide responses that align with social desirability or expectations rather than expressing their true opinions or behaviors, which will make the responses biased. Number 2, limited depth. Surveys are often structured, limiting the depth of information obtained compared to more qualitative methods like interviews. Number 3, sampling issues. If the sample is not representative, findings may not generalize to the broader population, leading to biased results. Number 4, validity concerns. The accuracy of survey results relies on the validity of the questions, and poorly designed surveys may yield inaccurate or misleading data. Number 5, limited insight into causation. Surveys can establish associations between variables, but may not provide insight into causal relationships. Now let's talk about the last section of the chapter, that is, significance of psychology in nursing. Number 1, understanding patient behavior. Psychology plays a crucial role in nursing by providing nurses with insights into patient behavior, emotions, and mental health. A deep understanding of psychological principles helps nurses anticipate and address the diverse emotional responses of patients, facilitating effective communication and building therapeutic relationships. This knowledge allows nurses to approach patient care with empathy, recognizing the impact of psychological factors on health outcomes. By integrating psychological perspectives, nurses can tailor their care strategies to meet the emotional and mental health needs of patients, contributing to holistic and patient-centered healthcare. Number 2, effective communication and therapeutic relationships. Effective communication is at the core of nursing practice, and psychology provides valuable tools for nurses to enhance their communication skills. Understanding how patients process information, express emotions, and perceive healthcare interactions enables nurses to communicate in a sensitive and patient-centered manner. Psychological knowledge helps nurses to navigate challenging conversations, address patient concerns, and establish therapeutic relationships built on trust and empathy. By incorporating psychological principles, nurses can create a supportive environment that encourages open communication, shared decision-making, and active collaboration between healthcare providers and patients. Number 3, stress management and self-care. Nursing is inherently demanding, and psychology plays a pivotal role in helping nurses manage stress and prioritize their well-being. Knowledge of stressors in the healthcare environment, coupled with an understanding of individual coping mechanisms, empowers nurses to develop effective stress management strategies. Psychological insights also promote self-awareness, enabling nurses to recognize signs of burnout or compassion, fatigue, and take proactive steps towards self-care. By incorporating psychological principles into nursing practice, healthcare organizations can foster a culture of well-being, resilience, and professional satisfaction among nursing staff, ultimately contributing to the overall quality of patient care. Number 4, enhancing patient education and health literacy. Psychology in nursing contributes significantly to patient education by recognizing individual learning styles, cognitive abilities, and emotional readiness. Nurses with psychological insights can tailor health information to match the patient's understanding and preferences, facilitating improved health literacy. This approach empowers patients to actively participate in their care, make informed decisions, and adopt healthier lifestyles. By incorporating psychological principles, nurses bridge communication gaps and promote a collaborative learning environment that positively impacts patient outcomes. Number 5. Preventing and managing mental health challenges. In nursing, an understanding of psychology is crucial for identifying early signs of mental health challenges in patients. Nurses trained in psychological principles can recognize symptoms of anxiety, depression, or other mental health issues, leading to timely interventions and appropriate referrals. This proactive stance aids in preventing the escalation of mental health problems and ensures that patients receive comprehensive care, addressing both physical and psychological well-being. Psychology equips nurses with tools for empathetic communication and support, fostering a therapeutic environment conducive to the mental health recovery of patients.